Hello everyone. Let us learn the anatomy of sixth cranial nerve, that is the abducent nerve. Abducent nerve supplies to a muscle called as lateral rectus muscle of the eyeball. Nucleus of the sixth cranial nerve, that is the abducent nerve, is located in the upper part of floor of fourth ventricle in the lower pons and beneath the facial colliculus. Ventromedially, it is closely related to the medial longitudinal bundle. And the fibers arising from this nuclei will be supplying to the lateral rectus muscle of the eyeball. Now let us analyze the course of the sixth cranial nerve. So in its intracranial course, the sixth cranial nerve runs ventrally and downwards and reaches to the lower border of the pons, or we can say pontomedullary junction. The nerve is attached to the lower border of the pons, opposite to upper end of pyramid of the medulla. The nerve then runs upwards, forwards and laterally through the cisterna pontis. Then it reaches to the cavernous sinus by piercing its posterior wall. Then in the cavernous sinus, this nerve, the sixth cranial nerve, first lies lateral to the internal carotid artery, then inferolateral to it. After traveling in relation with the cavernous sinus, this abducent nerve enters to the orbit by passing through the superior orbital fissure. In the superior orbital fissure, the abducent nerve will be inferolateral to oculomotor and nasociliary nerve. And after entering to the orbit, the nerve ends by supplying the lateral rectus muscle at its ocular surface. So, injury to the abducent nerve can cause paralysis of the lateral rectus, and the affected eye cannot be abducted. So, failure of abduction of the affected eye is the clinical feature. This can happen sometimes in excess or raised intracranial pressure.